Good afternoon. My name is Destiny Barber,
Maya Davis.
MOG Slotty Shogun.
and we are doing our research project on the health disparity between white and black children in regards to the attention deficit hyperactivity disorder, better known as ADHD. We first will start our paper with introducing the statistics regarding the disorder. Then we will go into the sociological approach that we will be using to analyze the disorder, and then we will offer policy recommendations in which they will help close the disparity gap.
And for some background, ADHD is known as attention hyperactivity deficit disorder. It affects 5 million children and students in this country, and there are 3 different types of ADHD. The first is the hyperactive type, the second is the combined type, and the third is the primarily inattentive type. The hyperactive type basically is when most of the behavioral aspects that are found with ADHD, that's usually where you will see it with children who are diagnosed with that. The combined type is basically a combination between having the hyperactive portion, like the impulse control, and like not being able to pay attention. And the primarily inattentive type is basically known as like you can't focus. And that was formerly known as ADHD. Some statistics in regards to ADHD and black children within this country. 10.7% of black children, according to chad.org, were diagnosed with ADHD. From 1997 to 2001, black and Latino children were less likely to be diagnosed with ADHD than their white peers. However, that statistic has gone up in recent decades. In regards to ADHD and how it's policed within schools, most black children without the diagnosis are typically punished harsher than their counterparts with ADHD. And in regards to the actual diagnosis, most children who are currently in juvenile detention centers have 32% of them have a learning disorder of some sort, whether it be ADHD or anything else. And this is helped along by the school to prison pipeline, which is basically when students are disproportionately punished, basically based on race and like forced into the criminal justice system, which leads to them becoming repeat offenders and therefore having their future opportunities taken away. It's also, another statistic is that there's a lot of black parents, there's a stigma towards people with ADHD, and they view it as like it's just a behavioral problem and it can be solved with corporal punishment, such as spanking. One study showed that less than 70% of black parents actually had accurate information in regards to what the causes of ADHD were and like what symptoms, and less than 40% had actual networks to help them learn about it and like help them adjust their parenting towards their children with ADHD. In addition to that, there's also a disconnect within the school system, since a lot of white parents do not want to like interact with black parents because they think that they often receive blunt responses from those parents, and a lot of times, especially with lower income families, black parents can't be involved as much because they're mostly focusing on the workplace and like taking care of the house, so they can't come to school as often. But one study showed that with a white teacher and her black families that had children with ADHD, they were able to build a rapport, and when you approach those families in a kind manner, they were more willing to hear policies and plans in regards to like making sure their children with ADHD were able to have a thriving school career, and they were more willing to work with the teacher, and thus that helped the students prosper in the process. Another thing that leads to a large health disparity between white children with ADHD and black children with ADHD is due to the fact that there's a stigma within the black community that if you have a child with ADHD and you medicate them, then it could be considered taking drugs, and it can lead to it could be a gateway to taking drugs in the future, like harder core drugs like methamphetamine or crack. So there's a lot of stigma within the community, and because of the lack of information available, this has led to it being harder for children to get the help that they need to.
The sociological perspective that we will be using for this research project is the bias theory, specifically Gunnar Myrdal's cumulative causality theory, in which it argues that the disadvantaged condition that Black Americans are facing reinforces the prejudice of white Americans' low opinions of them. This disparity faced by minority children in regards to ADHD is driven by underrepresentation and a lack of awareness, in which prejudice plays an active role in bias interactions.
In terms of policy recommendations, from the authors from the Pediatrics Journal, they put forth one recommendation, which they said, and I quote, "Our findings provide additional support to calls for increasing solicitations by pediatricians, school psychologists, teachers, and other clinicians of concerns by minority parents for their children's learning and behavior, ensuring sensitivity to differing cultural values about disability during well-child visits and referrals, and encouraging symptom recognition and help-seeking behaviors by these parents, and suggest that these efforts by clinicians can be made throughout minority children's early life course." So basically with this, I feel like the authors from the Pediatric Journal are basically saying, kind of like monitor these children earlier on before they reach, like higher education. Therefore, and then in turn of that, like their social interactions and also like learning interactions will be, will become better.